This part right here is the hard palate. As you can see, it's also lined by mucosa. At the side of the oral cavity, the mucosa lining is stratified squamous, keratinized epithelium. This keratinized epithelium, it's quite resistant, no, to friction and abrasive forces, no, because we put a lot of things inside our mouth, no? Aside from the food, the eating utensils, spoon and fork. What else? Some of you have the habit of placing your pens or your pencil inside your mouth, drinking straw. What else, no? The other objects, no, or other things that you place in your mouth, I will leave that up to your imagination. So this is stratified squamous keratinizing epithelium with very scant or very little submucosa, and actually the submucosa is closely adherent to the bone of the hard palate. So that is called your orthokeratinized or parakeratinized mucosa. But for this particular specimen, it was it's already partly separated from the bone of the hard palate. So let's try to retract the tongue. You can see the molar teeth right there, although our cadaver here is missing some of his molars and premolars. So you can see there is a mucosal fold right here, no? Stretching from the upper jaw going down to the lower jaw. So that mucosal fold is called the pterygomandibular raphe. Now, right in front of that is the retromolar region or the retromolar space. So when we close our mouth, the outer cavity of the mouth, which is the vestibular cavity or the vestibular space, retains its connection with the oral cavity proper at the retromolar region. So again, this is the pterygomandibular raphe. That structure is an important landmark, especially for dentists. Remember our inferior alveolar nerve or the inferior dental nerve. So when dentists are performing surgical procedures in the lower jaw, removal or extraction of molars, extraction of carious or decayed molar teeth, removal of impacted third molar or wisdom tooth here at the side of the mandible. So the anesthetic is injected here in this area at the pterygomandibular raphe, because that is where the inferior dental or inferior alveolar nerve will pass through. Okay, this is the floor of the mouth right here. The diaphragm-like muscle, supporting the main floor of the mouth is the myelohyoid muscle. The muscle on top of that is the Geniohyoid. Muscle on top of the myelohyoid is the geniohyoid. So attachment point for the geniohyoid, same with the attachment point of the genioglossus right here, genial line of the mandible. Then it's attached to the hyoid bone. Also, we have an extrinsic muscle of the tongue attached to the hyoid bone down here. That's the hyoglossus muscle. It pulls the tongue down. So this part right here, that's the sublingual space. No? The mucosa, which lines this area, is very thin. No? It's still stratified squamous, but it is thinner compared with the rest of the areas, no, inside the oral cavity. And the thin mucosa has plenty of blood vessels below it, no? Mainly sublingual veins. No? So the thin mucosa there can be used as a site for drug delivery. No? We sometimes place tablets or the powdery content of our capsules. Now we place it here for faster absorption. So that is sublingual route of drug administration. So what's the difference when you deliver your drug sublingual or when you ask your patient to swallow? Drugs delivered via the sublingual route will have greater concentration in the plasma because it's absorbed directly to the circulation. Unlike swallowed drugs, when we swallow, there is significant metabolism that will occur in the GI tract. It will be absorbed in the liver, where another round of metabolism will take place. So effect of drugs administered sublingual will be faster, no? And it has a greater effect, no? Also, there is greater risk for overdosage and greater risk for adverse effects. Going back to the surface of the tongue here, so the mucosa again is stratified squamous, also keratinizing, no? Keratinized stratified squamous, which is quite resistant to abrasive forces and friction. You can see that at the sides of the tongue, no, the sides of the tongue here appears wrinkled. That is because the muscle, no, the genioglossus is relaxed. No? The tongue will elongate and it will stretch, no, when the genioglossus muscle contracts. When you push your tongue out of your mouth.